The new COVID variant EG5.1, or Eris as it has been named, is now on the rise in Britain and in the US after doing the rounds with increasing frequency across a great deal of Asia. In all, 5.4% of about 4,500 respiratory cases reported in Britain this week have been COVID-19, up from 3.7% of about the same number a week earlier. And that marks a fairly rapid rise, and we have seen that happen before. When COVID starts to spread, it really can spread very fast indeed. And Eris particularly is driving this growth increasingly. About 1 in 7 cases now being reported in the UK are cases of the Eris strain. Back in July, not for long back, 11.8% of COVID-19 cases reported were Eris, according to the UK Health Security Agency, and that's now near 14%. And it was only earlier in July, in the first days of July, that authorities really became alert to Eris here. So that is then quite a rapid spread within just a few weeks. And this comes just weeks after COVID was declared by the World Health Organization on May the 5th this year not to be a public health emergency of international concern. Now, that brought some dubious reassurance. But for now, the good news is, and this is very important, that it is good news only for the moment that we can be certain of, that this strain appears no more dangerous than the Omicron variant that it has derived from, or from the Omicron spin-off Arcturus. It has been a pattern, of course, with viruses that in time they mutate to become less threatening over time, but that is by no means absolutely inevitable. And the WHO has warned that COVID-19 remains a major threat, and any new mutant that begins to spread very rapidly will have to be watched very carefully. And of course, there are other mutants that are already known to be surfacing that have been discovered. Those are under watch. The war against COVID seems past its most serious battles, but is by no means over. Hospitalization rates in Britain have begun to rise, though not to alarming levels, not as yet, again, we must emphasize. And this may partly be due to bad weather and a long spell of it. Continuing rain, like just now, is keeping people indoors, and that increases chances of getting infected. And it is being suggested also that the release of some popular films may be stepping up the spread of this new variant by way of packing large numbers of people into cinema halls for a fairly long stretch, and certainly an environment conducive to the spread of COVID or any other infection. Some of the spread may be caused also by a drop in immunity since a vaccination, and not many took a 4th dose, and those who did may not be protected from it any further down the line. It's been a while since that round was introduced. And down the line, this may raise the question about further vaccination, but that appears not a very popular option at the moment, at least until evidence surfaces to suggest that the new emerging variants such as Eris are any more dangerous than they appear to be at present.